Hello, in this video I'm going to be talking about ways your pre-existing medical conditions you have before you're even diagnosed with breast cancer, can affect your treatment. Before I do that, I'd love to invite you to subscribe to this YouTube channel. We're always putting out new and fresh content, so there's always something new to watch. I'd also love to invite you to go to Yerbba.com to get your personalized Yerbba report, and I'll talk about that more in just a moment so that you know a little bit more about it. So one of the things we talk about in medical care and in cancer care is personalized medicine. And that can mean one of a couple different things. We talk about personalizing your treatment to the tumor characteristics. So we'll talk about if your tumor is estrogen receptor positive, you will get these treatments. If it's HER2 positive, you'll get these treatments. If it's hormone receptor negative and HER2 negative, you'll get these treatments. So we look at a lot of tumor characteristics, not just those that I mentioned, but also the stage and other characteristics that allow your medical team to personalize the treatment to the tumor. Well, what about you? So there are a couple things that we need to take into account. The first is your body as a whole. If you are very fit and if you are young and have no other medical problems, you might want to be more aggressive, or you might say, despite that, my current fitness, I ask a lot of my body and I'm a marathoner, so I actually would favor a less aggressive approach. So in here, I'm bringing in two separate things about you. One is your fitness and other medical problems that you have. And I don't mean by fitness that you're unfit if you're not a marathoner, but your general well-being and your activity level, etc. How do those determine how we recommend treatments? And then the other, of course, is your preferences. You might want to check out our video on why your preferences matter during cancer treatment. That's been really helpful to lots of people. So in terms of the tumor, we can tailor treatments to the tumor, but we also have your body, and then your preferences, sort of your mind and spirit. Your body can have other medical conditions, and I'm going to go through a few of these. Before I do that, I do want to tell you about the Yerbba report. Your Yerbba report integrates with your medical record and tells us things at Yerbba about your tumor, the stage, the tumor characteristics, all the tests that have been done, and about your medical history. After you give us permission, Yerbba goes into and collects information from your medical records. It then looks at tumor characteristics. It's then looked at all your medical history, and a treatment plan comes up for you. Treatment options are given to you based on the whole person. All of our reports break down the medical information you've gotten, not using jargon. We are allergic to jargon, so we try to translate things into real people language while the medical jargon is still available to you. So we don't take anything away, we don't dumb it down, but we give it to you in several different ways, and then generate a report that's reviewed very carefully to make sure everything aligns with the information we got in your medical record. If you have diabetes, there are some precautions that need to be taken. Some of the things that are given, like corticosteroids to somebody getting chemotherapy to prevent nausea, can make your blood sugar go wild. And so working with your primary care doctor is really important. There are other medications that can alter your blood sugar levels that you need to know about, either lower them or raise them or just make them really labile, where they're kind of going up and down and up and down. If you have cardiovascular disease, we want to watch your blood pressure really carefully. If you have problems with the pump of your heart, if it doesn't pump as well, either related to diabetes or other things that have happened in your life, your body, even thyroid disease can cause heart problems, we want to make sure that your medical team takes that into account, and you'll be told these things matter in terms of the treatment you might be offered in this way. Liver disease requires that we tailor the doses, that the doses are lowered, and some drugs are actually not given in people with serious liver disease. Chemotherapy is mostly metabolized by the liver, but we do like to watch your kidney function, especially for medications like bisphosphonates. You can check out our new video on bisphosphonates here below. Last, if you have a serious mental illness, if you have schizophrenia, bipolar disorder, depression, anxiety, you'll want to let your medical team know that, because we want to prepare you for any emotional effects of treatment and of the whole experience itself. Now, as I mentioned, there are many other medical conditions that people have. Those are the big ones that I wanted to address. If you have another medical condition and are wondering what that means for your treatment, put it in the comments or questions below. We'll get back to you as soon as possible. Share your experience with the Yerbba community. I love seeing the way you support each other and share your experiences. Just a reminder to hop on over to yerbba.com to get your personalized report, and thank you for watching.